there, welcome to Nurse Table Talk. I'm Kathy,
I'm Julie.
and we are going to talk today about what case management is and why it's an important topic, and what case managers do, and how it could be a potential benefit to you, our viewer. So, a nurse case manager, they can be known as a care manager, a case manager. In some arenas, you'll hear the term nurse navigator, care coordinator. They're a specially trained nurse in efforts of coordinating care, the communication of that coordination, and collaborative efforts to make sure that that patient who is at the center of that conversation remains the center of that conversation. And we'll kind of explain how this kind of thing works. Nurse case managers are just one entity. There are other disciplines who can also serve as care managers. There's social workers. I've seen a lot of times in different arenas, there's physical therapists. It depends on what the course of care is, why they're there for that.
Right. To interject, Kathy and I are certified in case management as well. So that was an added skill set that we added to our nursing.
Yes, absolutely. So Julie, do you want to sort of explain to our viewer, like, because this is a new concept potentially, like where they would run into a nurse care manager or a care manager at?
Okay. So what I would do is refer my patients to their doctor's office and start there. Okay. And if sometimes their doctor's offices, not all have nurse case managers.
True.
But maybe a specialist would have, like, at a cardiac clinic or a cancer clinic, or for certain conditions like CHF.
So if I have congestive heart failure and I'm having trouble managing maybe my Lasix medication against my scale weight and I don't really understand my sodium restriction,
right.
I can call and ask to speak with a care manager or case manager who
right.
can better explain those things to me.
Right, and they will help, provide education, and they will also seek the doctor's help if they might need it and if you have questions. But they're an additional layer of support. They're
a true advocate.
Yeah, they're a liaison at your doctor's office. It's really hard to get a hold of doctors in their offices these days.
That's 90% of what we did, I think.
And so having another name, get the name of that person if they do have one, and get to know them. Ask to speak with them next time you go to the doctor's office. Mm-hmm. Put your face in front of them so they can identify who you are. They see a lot of people, and get to know them, and I feel like, and have them get to know you.
I feel like you can really run into care managers in a lot of different areas
right.
of care too, because like if you land in the hospital,
right.
there's going to be a case manager
right.
there. Now I don't know, we can't really speak for individual hospitals, but
right.
care managers are there to coordinate what that person needs and what they anticipate they will
right.
need when they get home.
Right.
So that's another layer. They're
long-term care
settings.
Right. Long-term care settings. You've heard of care conferences, and again, it's a collaboration of many disciplines about that patient.
Yeah.
And addressing that patient's concern. It's all patient-centered.
Patient-centered, very, very much so.
There's legal nurse case managers out there that might be able to help go to doctor's appointments and as a patient advocate.
Oh yeah,
So
and
that could be one.
And disability, workmen's comp,
right.
all of those
return to work programs
have case managers.
Again,
also.
It's all coordination with the patient and with that patient's providers, meaning they're all kinds of their disciplines. Their doctor, there's any specialist
Pharmacy,
that they might have.
It's
insurance
coordinating
company,
all of it. Yeah.
It's a medical supply equipment companies.
I think part of why it's so hard to explain it like a definition is because
right.
I feel like it's everything that's not immediately medical.
Right.
Falls under
right.
case management.
Right.
If you can breathe, you need a care manager. If you
right.
can't breathe, you need to go to the hospital.
Right.
So it's a huge entity. But the reason that she and I are both like pretty passionate about this is that like I mean, we can give you examples over and over and over again of people that we've touched in our careers
right.
as care managers where we've made a positive impact for folks. So like if I have a patient who has congestive heart failure and their doctor keeps changing their medicine and they're not getting anywhere, I can interject, have a conversation with that person, get to the meat and potatoes of what is going on. Is the med too expensive? Are they not taking it correctly? Is it just not working? Are
Right.
they taking it at the wrong time?
Right.
And I can work with the doctor's office to make sure we're all on the same page, and then I can follow back up with the patient and do that teaching,
Right.
and then come up with a follow-up plan. And that's big.
Right, and there's a lot of things that people may not know about other conditions too, like COPD. Okay, so they are on oxygen and they have a primary care physician, but maybe they just moved to a new area and they don't have a pulmonologist yet, and so maybe they need that extra layer of medical support. And
Someone
so,
to help them get connected.
Right,
All part of
right.
that connection piece
Right,
of our job too.
right. So these are just a few examples. You're being the go-to person, so to speak.
Yeah,
And
yeah, and the other thing I feel like is a really good way to really sort of demonstrate this is I always take everything back to a car. Isn't that funny?
That's
Always
okay.
have, always
that's
have.
okay. It's an analogy that
Yeah.
you associate with.
So I understand my tires. I understand why I need an oil change.
Right.
I understand that I need power steering fluid. I understand that I need windshield wiper fluid. I understand all of that, right?
Right.
Little bits, parts, and pieces. I get
Right.
all that.
Right.
That check.
Right.
But when you pull it all together, and the driving system that makes all those pieces of my car work,
Right.
I wouldn't have a clue.
Where do
I
you
wouldn't
start?
even know who to ask, and I wouldn't know what
Right.
to ask them. And
You have
case
all those
management,
moving parts.
yeah, and case management is very much like that. It's saying you're a person with all of these systems: lungs, heart, skin, brain, emotions,
Kidneys.
all of that
Right.
stuff, right? You got to have somebody who sits in the middle of that, who can help you navigate across your multiple providers, the multiple doctors that you see, the different medicines that everyone is prescribing, the side effects of one part of your treatment against another part of your treatment. And so so that's why it's difficult to explain this, is because it's sort of a big deal.
Right. But remember, they can be your go-to person and help simplify.
Yes. Yes.
And have them. They may have you make the calls and do some of the work, because this is, you want to be proactive about your own health. I mean, but they're there to help guide you.
Yeah.
They're not there to do it for you. They're there to guide you.
Help you figure out what questions to ask, who to ask the questions of, what to expect as a reasonable time frame of
Right.
return telephone calls, that kind of thing. So it's super duper broad. I think if you're interested in case management or you have other questions, there are some really good entities that Julie and I can point you to that would help
Right.
you at least get you connected. First of
Right.
all, if you're a veteran,
Right.
the VA services do have case management services.
Yes, they do, and a lot of people don't know about that.
On the back of your medical insurance card, there's a 1-800 number if you have insurance.
Right.
If you call that number and ask them for care management, tell them you're struggling with pieces and parts of your health care, they will connect you with services. Another place is often, we mentioned a primary care doctor's office,
Right.
but sometimes they do, sometimes they don't.
Right.
It really is kind of hit or miss yet at this point.
Specialist office again,
Yep.
be sure to ask, and they'll get you
Also,
started.
there's before I forget, there's also Commission on Aging's
Resources out there, yeah.
and
Sometimes
area
they have
agencies.
they may have case managers.
Mhm.
If you have home care services, now again, the doctors usually order that if you would need that, and if you're homebound generally. But they may have a case manager taking the lead on,
Yeah.
overseeing the whole plan of your treatment of, you might have other specialists,
Mhm.
home health aides, social workers, occupational people,
They-
therapists
yeah,
and that. So
they kind of act
they
as-
take a lead.
They
like
kind
a-
of act as the captain of your ship, if you will, for a while,
Right,
to get you
right.
into steady water, and then they go, oh, good boat analogy, and then they go away, and then
That
if
was
you
good.
need them, thank you, and then if you need them in the future, you've got their business card, you've got their phone number, you just call them up and say, hey, I'm in deep waters again, and I need your help. So,
Yeah, yeah.
So I hope that this wasn't too confusing. We just want to just introduce the
Kind of give you
concept
an
of
idea
case
of where
management.
they're located, and be sure and ask. That
Yes.
would be the big
Yes.
takeaway from
Be
today.
the squeaky
Take
wheel.
names and numbers.
All right. Thank you. You have a great day.
Bye now.
Like the content you just watched? Hit the like button or hit subscribe here. If you want to be notified of any future videos, please ring that bell. If there's any topic you'd like to see discussed, leave us a comment in the comment section. Nurse Table Talk. Save time, save money, be informed. Thanks for watching.